A growing number of states and countries are detecting the COVID-19 Omicron variant, though it has yet to be identified here in Illinois. Some say the mutation highlights the importance of an equitable vaccine distribution across the globe to prevent more variants from emerging. Now, this comes amid criticism of the U.S. and other countries for travel bans to South Africa and nearby nations. Joining us to talk about addressing the pandemic from a global perspective are Dr. Richard Novak, head of the Infectious Disease Division at UI Health, and Dr. Shala OLOPADE, Director of Clinical Programs at the Center for Global Health at the University of Chicago. He's also Dean for Academic Affairs in the Biological Sciences Division. Doctors, thanks to you both for joining us. Dr. Novak, let's start with you, please. Can you first remind us how variants emerge and where they are most likely to emerge?
Sure. So when this pandemic began, SARS-CoV-2 had never been in the human population, and humans were completely naive to it, and so it could replicate with impunity, and so it evolved. The viruses all mutate and evolve, and they follow a natural selection. So they are mainly competing with one another to see which virus would grow the most rapidly, most efficiently. And so the earliest variants were ones that could really replicate better and better in human cells. And then as immunity started to appear in the human population after repeated exposures to virus and the introduction of vaccines, more recent variants are responding to the immune system through what we call immune escape. They're trying to create they're being selected for mutations that help it escape the immune system. So we're seeing a combination of those things now. We're seeing viruses that both replicate very well and are starting to evade the immune response.
And so it should be noted, of course, that South Africa has a higher vaccination rate compared to other countries on the continent, and it's not clear just where Omicron first emerged. But Dr. OLOPADE, from your perspective, how has vaccine distribution around the world gone?
Thanks for having me. I think the vaccine distribution has not gone very well because at the beginning of the pandemic, high-income countries, I don't blame them, prioritized the vaccination of their people, while a lot of the low-income country settings didn't have the resources to have access to any vaccine. So there's that disparity that's still there, where many of us here are getting our boosters, whereas in Africa, if you use Africa as an example, vaccination rate is in the 4 to 5% range. And that's not going to make it safe for all of us, because as Dr. Novak just said, if you have a lot of unvaccinated people for the virus to infect, it provides a perfect opportunity for all of these variants to develop, which makes all of us vulnerable because of the ease of travel across the globe.
Now, after South Africa first announced the variant, many governments enacted travel bans to South Africa and nearby countries, including the U.S. Earlier today, we spoke with medical anthropologist Michael Diamond about this. He's a professor at DePaul University and president of World Resources Chicago.
They have a tremendous surveillance system and a very robust laboratory system. And so they've been able to identify that this new Omicron variant very early on. The downside for South Africa is when they came forward with this information, they were then penalized by countries banning all travel from not only South Africa, but Southern Africa and other African countries. And so this sends a message of sanctions to other countries that want to come forward.
Dr. Novak, first, how effective even are travel bans?
Well, in this case, it's probably too little too late, frankly. The so-called horses out of the barn, I suspect, because we're already seeing the Omicron variant. It's already in at least 17 states. And it's in a number of countries. It's all over Europe already. It's in various parts of Asia. So spreading had already occurred before South Africa identified the Omicron variant in within South Africa. So have a small impact on slowing the spread of the virus, but in this case, I suspect it didn't have much of an effect. I think that the spread had already occurred, and it's not going to stop the virus from getting everywhere because people travel and they carry the virus before they even know they have it.
And Dr. OLOPADE, could travel bans like those disincentivize countries from coming forward with that new information about new variants when they find them?
I think the travel ban, as punitive as it sounds, I don't think many of our colleagues who are academics like us will be disingenuous in not sharing the results of their expertise in being able to do the whole genome sequencing that's potentially helped all of us to do the planning. And most people might be unaware that the United States government over time has invested maybe up to $180 million to provide infrastructure to do all of this genomic testing in Africa by Africans. The unintended consequences is that we worsen the economic situation in these countries. We dismantle the fragile healthcare infrastructure and allow more people to be infected and making all of us unsafe. So I don't think it's a smart decision to ostracize some of these countries, but I trust our colleagues to continue to do the exceptional work that will inform the body of knowledge and make lifesaver for all of us.
Dr. OLOPADE, what can be done then to improve vaccine access in the more vulnerable countries?
I think if you look at the WHO as a vehicle for through COVAX, through Gavi Alliance, they're very sophisticated group of people that have been able to negotiate competitive pricing for vaccine over time. I think if we can do that and have some of the high-income or wealthy countries also make significant contributions, either in terms of vaccine or in terms of financial support to help both the Gavi Alliance and COVAX through the WHO. I think it might help us to narrow the gap if we can get over the vaccine hesitancy and all of the bad information that's out there.
Some of which we experience here in this country as well. Dr. Richard Novak and Dr. Shala OLOPADE, that's all we've got time for. Thanks to you both for joining us.
Thanks for having me.
Thanks so much.